Hi, this is Dr. Michael Murray, founder of the Sleep Apnea Center of Connecticut. Sleep apnea. When we sleep, our muscles relax. And when we sleep, we basically don't know what's happening when we're sleeping. We're, for the most part, not conscious. As our muscles relax, the muscles that hold our lower jaw in place also relax, and our jaw can begin to fall back. And as that happens, our tongue, partially attached to our lower jaw, falls back, and that can begin to close the airspace in the back of our throat behind our tongue. And so as our tongue falls back, that airspace begins to get very narrow. Now, our air coming in and out of our lungs is at a particular pressure, and as it tries to come in and out, as that space gets more narrow, it makes noise. Basically, that is what snoring is the air trying to push its way through that very narrow space. However, if that tongue fully closes and collapses, it closes the airspace, it obstructs it, called obstructive sleep apnea, like putting a cork in a bottle. No air gets in and no air gets out. And when that happens, our oxygen begins to fall, and our body basically responds by putting us in survival mode. Our body will not let us not breathe. And so our brain sets off a whole reaction with chemicals like cortisol, epinephrine, and others that are meant to save us, but also are not healthy for our heart, for our brain, and for our well-being. As this happens, it disrupts our sleep cycles, makes it difficult for us to get into deeper sleep stages, which research shows are where our brain filters, gets refreshed. And so if we're not getting that restful, refreshing sleep, we wake up feeling tired, excessive daytime tiredness. You get tired when you drive, feeling like you need to take a nap. Long term, it's also highly associated with cognitive decline, dementia, Alzheimer's disease, because the brain not filtering is very unhealthy. It's highly linked with dangerous heart conditions such as high blood pressure, arrhythmia, and increased risk for heart attack. Plus, you just feel tired during the day, and you think it's just because I'm busy and I'm getting older or I've put some weight on. Well, it sounds like it could be obstructive sleep apnea, and treating that is very important for your health and for you to feel good during the day. You want to feel good and have plenty of energy to work well and enjoy life.